In 2025, the government published a 10-year health plan for England. The plan outlines the changes that need to be delivered to make the NHS fit for the future. To understand what the public and health and care staff want to see in the plan and inform its development, the Department of Health and Social Care invited staff and users of the NHS to discuss what they wanted from a future NHS. This conversation received over 250,000 contributions from members of the public and NHS staff.
We're kicking off the biggest conversation in the history of the National Health Service because we can see the scale of the crisis. We're already taking steps to get the NHS back on its feet, but we're also shaping a 10-year plan to make sure the NHS is fit for the future. And I genuinely think, while we could have come in as a government and imposed change, I genuinely think that change is better done with people than to people. And I also think that some of the best ideas we'll get about how the NHS can improve will come from the people on the front line who work in it, and crucially, the patients who use it.
Throughout the engagement, we've been supported by public dialogue specialists, Thinks Insight and Strategy, and their partners Kaleidoscope Health and Care and the Institute for Public Policy Research. There were lots of different ways for members of the public and health and care staff to shape the plan. From the Change NHS website, where everyone aged 16 and over could have their say, to workshops held by groups and organisations in communities across the country with people who are seldom heard in consultations of this scale. More than 17,000 people participated in this conversation. We also ran deliberative events online and in person across the country with 730 members of the public and 3,000 health and care staff, supporting people from different roles and walks in life to discuss and deliberate key elements of the plan. This also included an event with 27 children and young people aged 7 to 18. We consulted with NHS leaders and partner organisations to understand their perspectives. Finally, we hosted a national summit where almost 300 members of the public and staff from across England came together to share their thoughts on the future of the health service and discuss final proposals for the 10-year plan.
It's really good being here at this workshop to actually think about the future and what's going to happen in the next 10 years and be able to contribute to that. It's also really good to be with other people within the NHS.
Being part of this discussion makes me feel included as the public, and my opinion feels heard.
In the past, I'll be sitting with a group of doctors who would assume what the problem is, whereas in this one, we've got a pharmacist, a couple of nurses, a paramedic, social services.
It's the first engagement event I've been to where it feels like the input is being recorded rather than rephrased.
When you come to something like this, you're reignited again to say, actually, I do have a voice and I'll continue to try and make change and influence the decisions that are made.
When I see the NHS in 10 years, I can kind of think I was actually part of that.
Throughout the engagement, we heard that the NHS feels like it's in crisis. In particular, the public told us about the challenges associated with access to care. Staff told us about the challenges with staffing levels, funding, and poor technology, which they say makes it really difficult to do their job.
They're strained to capacity, really.
I share the desperation of many people that, as Wes Streeting says, the NHS is broken and we've got to do something major to stop winter happening in July.
We can remember times when things were maybe a little bit easier to get appointments, easier to get services, and we need to get back to a position where we feel confident with the NHS and the services that we're receiving. At the minute, we're all feeling a little bit disheartened.
It is underfunded, it's demoralising, it's incredibly difficult.
Wait times is probably the biggest issue we have with the NHS, and being able to try and figure out ways to fix that, it means the world to me.
But we also heard how proud the public and staff are of the NHS and are committed to ensuring its future.
The NHS is one of the very best things about our country. I really don't want for us to lose such an important part of our lives, an important part of our Britishness almost.
It's so much different in other countries, and it makes me appreciate where I live and the healthcare that I can access.
The one thing I'm taking away from this is how passionate everyone is about the NHS, and we want it to succeed.
We all believe in it, we all want it to work, and we desperately care for our patients and desperately care for the work that we deliver.
As part of the engagement, we explored the 3 shifts that form a significant part of the 10-year health plan. They are moving from analogue to digital, moving care from hospital to communities, and moving from treating sickness to preventing it. People supported the 3 shifts and could see how they could help deliver a better and more efficient NHS. However, they also raised some worries about each that the plan will need to address. Moving from analogue to digital.
IT innovations, they will happen whether we're ready or not for them. It's not going to replace us, but it's going to enhance our ability to provide care and to be able to spend more time directly with our patients.
We've talked about the fact that sometimes you had to tell your story 3 or 4 times. If we have an efficient digital system, that would take that away, that need to tell your story more than once, but it would also allow for services to be opened up much more broadly.
Having one universal way that we can all communicate patients' needs, requirements, and keep patients safe.
We need choice, we need options, we need people to be able to opt in and opt out of certain things, it be used as a tool. And then obviously we did have quite a few questions raised based on accountability and decision making, at what point the AA makes a decision or whether it's a human being.
I'm really excited to hopefully see an increased use in the NHS app, people being empowered to self-manage their conditions.
Moving care from hospital to communities.
We didn't actually realise how much was done in the community compared to in what we class as the normal hospitals and the in and out patients.
What kind of struck me was the number of people that will bypass the general practitioner and present to the emergency department, and I'm quite keen to promote keeping the care within the community.
I thought the mobile screening centres was amazing. They would be able to test for things like lung cancer, and I feel like that would be amazing for rural communities, as well as people who just see them when they're walking to the shop.
Rather than relying upon doctors and hospitals, how do we work with primary care? How do we work with optometrists and pharmacists and physios and other healthcare specialists in the community to deliver care for our whole population?
Moving from treating sickness to preventing it.
Although we talk a lot about prevention, and we have done for many years, it's not really where the priority has been, and we see that in terms of funding, but also in terms of staff training. Prevention doesn't happen overnight, but hopefully as part of a 10-year plan, you will see improvements.
So if we can implement that now, in 10 years' time, we won't have to do this again, potentially.
If you're putting money and investment and time and care into preventative services, for a period of time, you have to see that investment to continue with the current acute services, the current kind of fixing the diseases that are already there, but also you need to try and put in that money and that investment to preventative, and slowly that should change where that push is, but it will take time and investment.
This engagement culminated in a national summit where members of the public and staff discussed how these shifts could be implemented.
All of these people behind me, they've been part of the earlier consultation about their experiences of the NHS and what they want to see change. Today we brought them back to share some of our ideas, some of the thinking that's gone into the draft 10-year plan, and this is their chance to kick the tires on it, because this has got to be all of our plan to get the NHS not just back on its feet, but to make sure it's fit for the future and to make sure it's always there for us when we need it.
This engagement is a landmark moment in the history of the NHS, with over 250,000 contributions, including people from seldom heard groups. The scale of this response illustrates the passion people have for the NHS and their desire to fix it and protect it for generations to come. Their contributions can be seen throughout the 10-year health plan.
For the first time in a long time, I feel like there's an appetite for change, but it does definitely feel like it's not just a soundbite, like actually something's going to happen from this.
I'm optimistic that it's achievable. I'm optimistic that it focuses of the 3 shifts are right.
It makes me very optimistic that the future of the NHS will be based on what is best for people accessing the NHS.